Concussions are a mild form of traumatic brain injury that occurs after a blow to the head, and in impact, the brain is pushed against the inside of the skull and can be bruised. And during that, different parts of the brain can move at different speeds, which cause shearing forces that can stretch and tear nerve tissue, which contributes to an alteration in ion and chemical balances, which impair nerve cell function and can cause a loss of consciousness, as seen in some concussions. And severely injured nerve fibers can permanently lose their ability to send signals and communicate with other brain cells. Post-concussional symptoms such as headaches, dizziness, fatigue, impaired focus, and an increased sensitivity to light and sound can occur, and symptoms usually clear up within a few weeks, but in some individuals they can last longer and can be responsible for prolonged damage in cognitive function. The long-term effects of concussions. One thing I researched for this topic was CTE, which is chronic traumatic encephalopathy, and it is a degenerative brain disease found in athletes, military veterans, and others with a history of repetitive brain trauma. But it doesn't mean just a few concussions. Most people that have CTE suffered hundreds or thousands of head impacts over the course of many years playing in a contact sport or serving in the military. And it's not just concussions. The best evidence points towards hits to the head that don't cause full-blown concussions as the biggest factor contributing to the development of CTE. And in CTE, a protein called tau forms clumps that slowly spread throughout the brain, killing brain cells. And it has been seen in people as young as 17, but symptoms don't generally appear until years after the onset of the head impacts. Early symptoms of CTE usually appear in a patient's late 20s or 30s and affect the patient's mood and behavior. Some common changes seen are impulse control problems, aggression, depression, and paranoia. And as the disease progresses, some patients may experience problems with thinking and memory, including memory loss, confusion, impaired judgment, and eventually progressive dementia. Cognitive symptoms tend to appear later than mood and behavioral symptoms, and generally first appear in a patient's 40s or 50s. And in some cases, symptoms worsen with time, even if the patient suffers no additional head injuries. And in other cases, symptoms may be stable for years before worsening, but as of now, CTE can't officially be diagnosed until after death. Dangers of contact sports, mostly just injury, especially to the brain. And in relation to this topic, concussions and repetitive concussions are probably the biggest danger of contact sports. Do I think children should participate in contact sports? I have some facts to present before I give my opinion. Athletes who begin playing contact sports at younger ages are at a greater risk for CTE, and several published studies show that exposure to head impacts before age 12 is associated with worse outcomes than starting after age 12. And concussions in young brains may be more severe than concussions in mature brains because it takes less force to concuss a child, and the effects may linger for longer than in adults. And on the legal front, several states have made it illegal for a school athlete to return to play without a doctor's clearance. And a lot of schools have started concussion testing where you take a test at the beginning of the season, and if you have a head injury anytime throughout the season, you retake it, and if there's a significant change, then it can indicate head injury and you won't be able to play again until you're cleared by a doctor. And so concussion testing keeps players from hiding their head injuries for fears of being benched, not being able to participate. I do think that children should be allowed to participate in contact sports, but obviously safety of them is the number one priority, so I feel that if repetitive injury, especially to the brain, is occurring, then it should be talked about whether the sport is worth their life. So yeah, that's my opinion on that. Sorry for the really long video.